Good afternoon, everybody. Welcome to the weekly Greater Manchester briefing. We thought we'd surprise you all today by starting bang on time, so that's probably caught a few of you out. Back in my loft with my beams this week, with the sun outside, so it feels very 2020 all over again. So flashbacks for you all. I'm joined by Baroness Bev Hughes today, and Bev will take us through the most recent position with regard to policing and enforcement in Greater Manchester, but I will begin with the slides. So Kate, if you could put the first slide up for us, please. So this is the latest picture with regard to the positive cases per 100,000 population across Greater Manchester. Progress again, and we've dipped below the 200 mark for the overall 7-day positive case rate, which is good, but that now is above England average. Just a couple of things to point out within this slide. 2 of our boroughs registering an increase, those being Bury and Tameside. And I think the thing to say overall is that Greater Manchester again is recording a slower rate of decline than the rate that we see in other parts of the country. And this has been a feature of the pandemic because of the endemic nature of the virus within some of our communities and some of the inequalities that we experience. So just to say a little more about that, wanted just to dwell on that today, because it is relevant with respect to the reopening consideration. We do have to ask, don't we, why have we always had a higher case rate? And I think it's very much linked to work and the fact that in many of the communities of Greater Manchester, a higher percentage of people have been out at work right throughout the pandemic because they have to go out to work. They can't do their work from home. And I think we have a higher percentage of people who have stayed out at work all through the pandemic than in more semi-rural areas, other parts of the country. And of course, many of those people, when they return home in the evening, will return home to housing where it's harder for people to self-isolate. And those 2 factors, work and housing, we believe more than any other, explain why we have that higher case rate, the nature of work and housing. So this brings me to something I wanted to say today, which is relevant to the government's consideration of issues with regard to the reopening or the unlocking of the national lockdown. The first is on workplace safety. We continue to receive complaints from members of the public about certain workplaces, and that has been something that has been consistent right throughout the pandemic, almost for a year now. And we don't believe enough focus has ever been placed on workplace safety from a national level. The regulations are quite loose with respect to that. But also we've seen in recent days the emergence of the position of the Health and Safety Executive on this issue, classifying COVID-19 in their judgment as a significant workplace risk, but not a serious workplace risk. We don't believe that is the right judgment. And what we hear from colleagues in public health is that HSE haven't been active partners in managing workplace outbreaks as they would have liked to have seen. So one of the things I wanted to say today and to ask the government to consider is that they ask HSE to reconsider their decision not to classify COVID-19 as a serious workplace risk. We believe it should be classified as a serious workplace risk. HSE point to the fact that the vast majority of people recover from COVID, but we don't believe in a pandemic situation where many people have not recovered that is the appropriate judgment to reach. So that is the first call today of today's briefing, that we ask HSE to reconsider. The second is that the government also again consider what amounts to a much more substantial self-isolation support scheme. we've reported here before the gaps in the current scheme, the difficulty that many residents find in accessing self-isolation support. All of this is exacerbated by the emergence of new strains, and obviously we see those in the north of the city of Manchester now, in the same way that we saw in Moss Side last week. This issue of self-isolation support becomes critical with respect to the decisions that the government is about to announce. Mass testing, as the government is proposing today, will not work unless there is a system in place that allows people to act on the information if they test positive, and they need to isolate. And it isn't just financial support that people will need, the covering of their wages. They will also need absolute assurance that they will have a job to go back to at the end of their isolation period, and they can't be let go during that time. And that needs to be addressed in law, so that there is no doubt about that. Also, for those who live alone, the providing of essentials so that they can self-isolate. There needs to be a comprehensive package of support as recommended by SAGE in August last year. And this remains, in my view, the single biggest hole in the country's defences against COVID-19. So we just want to kind of make those points clear at the start today, because of the higher case rate here, which is obviously a similar situation as we faced last year, and we now need to use the knowledge of last year to have a more assertive approach with regard to workplace safety and a much more comprehensive, substantial self-employment support scheme. Okay, I will turn back to the slides and pick up on the age breakdown. A slide that's very familiar to people. What that shows is a reduction across the ages, and in most of our boroughs showing quite a yellow top line, which is obviously very positive, with just one or two exceptions, Manchester perhaps being one, but overall an improving picture across all of the age ranges. If I could go on to the next slide. This is slide on testing. Again, not a great deal to add on this, other than that the level of testing remains quite high across Greater Manchester, with the increased use of lateral flow testing, but that's a consistent and now quite positive picture. If we move on. This is obviously something that has surprised us a little, to see an increase in the case rate. 1.9% of care home residents equates to 292 people. So obviously we have this under close review. There are many reasons why the figure it isn't just necessarily new cases. It could be people who've had COVID for some time, but nevertheless, we will be keeping a close eye on that. Next slide, please. So here is a slide which shows, I think, the first considerable improvement in the position in our hospitals in some time. Actually, probably should rephrase that. I wouldn't say considerable improvement, but an improvement. There's been an easing of the pressure, although it was described to us this morning that the situation still remains very, very tight indeed. And particularly so in some hospitals. But overall, what we can see there is a reduction in weekly admissions, in transmissions within the hospital setting, a slight easing of pressure in critical care, and in general beds overall. So still high numbers, but obviously numbers that are reflecting an improvement. Although colleagues are very keen to point out that this remains a really difficult situation for the NHS across Greater Manchester. The overall figures for the system as a whole, we are currently running at 83% bed occupancy across the system. And of all patients currently in hospital in Greater Manchester, 17% are COVID patients, which is a pretty big reduction on the 30% of patients that had 30% of people in hospital who had COVID just a few weeks ago. So certainly signs of improvement. Early to say that the NHS is, if you like, in a in a position where it's out of the woods, but it's obviously positive news to see this improvement. And it's important for me just to add that the Greater Manchester system is still providing mutual aid to other parts of the country as part of all of this. So I think that's enough for me for now. I will return to the issue of vaccination and the government's decisions around the national lockdown. But before I get into those, I'm going to hand over to Baroness Beverly Hughes, who will take us through the latest position on enforcement matters. Bev, over to you.
Thank you very much indeed, Andy. Good afternoon, everybody. Well, on COVID-related activity by GMP and also by partners, local authorities, the picture's very much a continuation of what we've seen actually really since the start of the year, with increases in reports of COVID breaches from the public coming in all the time. In the last 7 days, up to Monday just gone, the 15th of February, the police dealt with 1,205 COVID incidents and issued 228 fixed penalty notices. As usual, the vast majority of that demand was over the weekend, with 180 fixed penalty notices issued then, bringing the total since August to over 3,500. So after a slight dip in very large gatherings that I reported on recently, we're seeing a resurgence of very large gatherings, and 55 £800 fixed penalty notices were issued in that last 7 days, 32 of those at one very large party event in Salford. Police have released footage as well of a large party in the Beetham Tower on Deansgate, which you may have seen, running from Friday night through Saturday, ending up in a very difficult situation to control a fight with about 50 people. And the owner is being pursued there for the £10,000 fine. You know, I think if you see that, you just see what very difficult situations officers have to go into. Putting themselves at risk in a variety of different ways. Other events included a works party in an industrial estate in Salford, a wedding party in Oldham, and many other parties and gatherings. In terms of the business community, the joint visits by the police and local authority enforcement officers under Operation Kingfisher continued, with visits to licensed premises, as well as a variety of businesses, and literally hundreds of those visits conducted over the last week right across Greater Manchester. General compliance is good for most businesses, but with some notable exceptions. And a trend recently for gyms in different parts of Greater Manchester to be found to be open, a very large yoga gathering in Stockport, resulting in a £10,000 fine. A cafe that we talked about last week in Burnham that was very problematic is now subject to a closure order that Manchester City Council have got, and that will exist until May. And an increased trend as well to follow reports and find backroom bars and pubs taking place, unlicensed obviously, in closed premises. In touch with colleagues in other parts of the country, particularly metropolitan areas, the trend is pretty much the same. And I think, you know, the police everywhere are feeling that there's a lot more resistance now to intervention by the police. If they're called to a house, householders are reluctant very often now to let them enter the house to check on what's happening. And I think that's going to be an increasing trend. We're looking ahead now and thinking about what happened the last time restrictions were lifted after a lockdown, and looking at the contingencies we might need to take, anticipating some of the same trends that we saw then, possibly many more smaller events in houses, which is what we saw then, more diverse activity possibly. We also at that time saw a rise in street robberies. So police are, with our local authority partners, thinking about the future and how we need to prepare for that. I mentioned last week the crime support line that was set up for members of the public concerned about the way their crime had been dealt with following the inspectorate's report. And I think I said that the number of calls was waning significantly. That number is going to be discontinued on Friday, but calls for anybody that is still using that number will be diverted to the main victim support line, where equally qualified people will be able to help them if it turns out they do have a residual issue as a victim of a crime. And then I just wanted to say a bit about elections, really. We're planning now for the local elections. We're assuming they are going to take place in May. The notice of that election will be posted on the 29th of March. And in our city region, as you'll know, there are elections in all local authorities, a mayoral election in Salford, and of course a mayoral election for the Mayor of Greater Manchester. Thinking about the count and the arrangements for that, some areas, as usual, will do their count on polling day on the 6th of May. Others on Friday, the 8th of May, Friday the 7th of May, and the count for the mayoral election for Greater Manchester will be done centrally in Manchester on the 8th of May. And we're again looking at contingencies around that. Clearly, Manchester Central, that would normally be a venue for that, is currently being used as a Nightingale hospital, and we'll have to take a view if it continues to be used for that of another location. But the gold and silver meetings that take place now between the police and local authorities are continuing to look at all of those issues. We have been informed that leafleting by candidates and political parties will be exempt under the current COVID restrictions, so candidates will be able to go up to front doors and leaflet. I'm also informed apparently that people wanting to leaflet for any other reason, including anti-vaxxers and anti-lockdown protesters, similarly will be able to do so. So we'll have to wait and see, I think, what happens there. I think that's as much as I need to say now. Thanks, Andy.
Thanks very much indeed, Bev. So turning to two final items, vaccination and decisions about national lockdown. If we could turn to the vaccination slide. What this shows is the fantastic achievement of thousands of people in Greater Manchester successfully completing the first phase and the top four cohorts prioritised for vaccination. It's phenomenal, really, what's been done. So as you can see, 639,000 people having had at least a first dose by this Tuesday on those latest figures. Just to explain, we're presenting this slide to you in a slightly different way today. So just to explain, we're just trying to simplify it a little bit. So obviously that of over 70s, that's 90% of people who've received their first vaccine, which is, as I say, a phenomenal achievement. The figure that says 48% of over 50s, obviously those over 70s are included in that figure, as are health and social care staff and those who are extremely clinically vulnerable. But still, it's a helpful way of expressing the position that we're in now with regard to vaccinating the rest of the population. So almost half of over 50s done in their entirety, if you like, and almost 30% of people aged 18 and over. So that's the latest position on vaccination in Greater Manchester, and we hope that simplification will be helpful to you. I just want to say something about the mass vaccination centre, which I visited last Thursday. And I have to say, you know, what an impressive operation it is. And, you know, the staff they're completely dedicated to the task. And it has played a big part, of course, in the achievement of the figures that I've just mentioned. However, we do think there is a case for the government looking again at the use of the mass vaccination centre as we go now into this next phase of vaccination, and particularly then as we get beyond that into the younger cohorts. What we are seeing is many people now in the top age range that we saw in 1 to 4, but now with cohort 5 added, many people are choosing to go local. They're being offered the choice of the two, but they're choosing to be called up to a local vaccination centre, and consequently the utilisation rate of the mass vaccination centre at the Etihad has dropped quite low. It's below 50% and much lower than that on some days. And what I would want to say to the government is it's an excellent facility, as I say, full of dedicated staff, and we believe there is a really strong case to use that capacity to the full. There's no problem with vaccine supplies to the Etihad Centre. So there's two ways we think that in which that can be done. One, that they open the national booking system to people over 50, because it seems to us that people who are younger with more mobility are much more likely to use the mass vaccination centre. At the moment, we're working slowly down the age ranges, but actually the people that we're calling are much more likely to use local vaccination centres, and hence this growing issue of low utilisation of the mass vaccination centre. Another way of addressing the utilisation issue would be to allow Greater Manchester to use the spare capacity and call up people to be vaccinated. But it probably is simpler to consider a change to the national booking system. So I just would put that out there today, that the government may consider, if they would consider that, we think it would be the right thing to do. And it actually addresses something I was saying a couple of weeks ago, which is the strong case for accelerating vaccination in the parts of the country which have the lowest life expectancy, which would of course include parts of Greater Manchester. Amongst those over 50s, you've got many people who will have poorer health at a younger age than their counterparts in other parts of the country. But as I said earlier in this press briefing, many of them are still out at work in frontline professions, which also poses an additional risk to them. So if the mass vaccination centre was opened up to over 50s, many of the people across our 10 boroughs who are out at work, perhaps not in the best of health, would be able to go and take up those slots which are not currently being used. And as far as I understand, there is no problem of supply of vaccine to the centre. Every day goes by where we don't have a high utilisation rate. Obviously, there's lost vaccination slots that we won't be able to get back. So I put this forward in a constructive spirit. The vaccination programme is going really well, but obviously, as we enter new phases, new challenges will arise. And I think it's becoming clear now that we need to open up the mass vaccination centre to people who are perhaps younger, more mobile, and that is a call that we feel it's the right time to make that call on the government to make sure we make best use of the capacity that we've got. I'm going to finish just by reiterating our approach to the the decisions to be announced on Monday with regard to release from national lockdown. It remains a very firm Greater Manchester view that we should see a national phased approach to this. We do not want to see any return to the regional or sub-regional tiers, which we do not believe worked, were confusing and divisive. So our call on the government is to do that. Of course, if we move more quickly on vaccination, as I was saying, particularly amongst the working age groups, that can build further confidence around the phased approach to the unlocking of the economy. So that remains our very strong view, which we fed into the government, and we hope that will be what is announced on Monday. So Jimmy, I'm going to leave it there. I'm going to hand over to you to take us through today's questions. Thank you.
Thank you, Andy. The first question is from Matt Truern at BBC Radio Manchester. And Matt asks, how worrying is it, Andy, that the Kent variant has been found in two separate parts of Manchester? And how likely is it that it will be found elsewhere in Greater Manchester?
Well, thank you, Matt. Of course, it is worrying, but let's keep it in proportion as well. There is no evidence that it poses any more risks to the public at this stage, although it could be more highly transmissible. It doesn't necessarily mean that it would cause more harm. So it is a concern, but it presents an opportunity for me to thank the community in Moss Side for really working with the teams that have been on the ground there for the last 7 days or so. 3,000 tests have been carried out. I think around about 30 positive cases. We don't know yet whether they are all the new variant, by the way, so that isn't clear. But obviously those are cases we wouldn't have known about had the testing not been put in place, and it's clear to me that the community have really got behind it and supported what's being done. This operation has now been extended to the Moston area, as you know, and mass testing is being made available there. A smaller geographical area of around 5,000 people, but nevertheless a significant number of people who we are now asking to come forward to be tested. I think it could become a more common feature of handling of this pandemic going forward as we see new strains, but people must not be unduly alarmed by this. This is part of what will happen in this year. What we're seeing here is obviously a really strong front foot operation to get on top of these situations. But I do go back to the point I made near the start, Matt, around self-isolation support. Obviously, some of the communities affected are communities where there are high numbers of people out at work, sometimes in lower paid, insecure employment, who will find it very, very difficult to self-isolate. And that is why, particularly with the mutation of this virus, this issue of self-isolation support has to be resolved as part of the package of announcements that the government puts forward on Monday. To leave it unresolved at this stage of the pandemic would be to take unnecessary risks with both the health of communities in areas where the case rates are highest, but also to risks to the economy, because obviously it will mean we could be back in the situation where we see unlocking and then higher case rates. It's really critical now that we ensure we learn all of the lessons of last year. That says to me we need a tougher approach to workplace safety of the kind that I've mentioned before, with HSE reconsidering their decision and classifying COVID-19 as a serious workplace risk, alongside a self-isolation support scheme that is comprehensive in its nature, as recommended by SAGE.
Thank you, Andy. There are two questions now on people shielding. The first is from Jonathan Knott at the Local Government Chronicle, and then Lucy Tomlinson at Manchester Confidential. Jonathan says an extra 1.7 million people are now being asked to shield. Are you, Andy, confident that Greater Manchester's healthcare and local government services have the resources to support the region's people in this category? If not, what extra resources are needed? And Lucy asks, is there any data to suggest that there is a disproportionate amount of new shielders in the Greater Manchester area as compared to the national distribution?
To take the second question first, Lucy, I don't have the data to hand, but I expect there to be a slightly higher number for the reason I gave before, which is that there is a lower life expectancy in many of our communities than the national average, and people tend to develop chronic conditions at a younger age than sometimes we see elsewhere. So my guess is that there is a increase, but we would have to get those figures to you. Jonathan, on your question, I think the answer is, of course, yes. If there are to be more people being asked to stay at home, more call on our community hubs, it follows that local authorities need to be given additional resource to provide support, and that hasn't been there now for some time with regard to the shielding programme. So the government needs to be clear as to why it's asking this extra number of people to shield, and then put in the resources in place that allow local authorities to provide the backup that's needed. Thank you, Andy. There are two questions now on the easing of lockdown, or at least the review on Monday.
First is from Tom Downback at Hits Radio, the second from Maya Wolf-Robinson at The Guardian. Tom asks, I know on past press conferences you've discussed this, but with Boris Johnson announcing his roadmap on Monday, what would your message to the government be, Andy, in terms of easing lockdown here? Data shows rates are still falling slower here than the England average. And then Maya's question is, have you been consulted, Andy, by the government on lockdown easing? And if you did, what did you say? If you haven't been consulted, what would you say?
So the answer to both of you in terms of the message to the government is no return to tears. Please, let's not repeat the mistakes of 2020 with new strains around. Tears, in my view, won't be able to provide an adequate defence. They didn't provide an adequate defence against the original strain, and I don't believe they will do so against any variant strains of the virus. And of course, what that also brings in is the confusion that people experience with tears, and the incentive to travel to areas where there are lower levels of restrictions. I think we need to learn from last year. Maintain the national approach that we are currently in. We have put that view in, Maya, to the government. The Greater Manchester team met civil servants last week to put in our view. And, you know, like everywhere else, we are waiting to hear the government's decisions. We would expect that those decisions are being taken today or tomorrow. There would appear to be a lower case rate in other parts of the country and something of a North or North Midlands divide. But, you know, the government has to bear in mind, again, as happened last year, the latest situation began with a exponential increase in cases in London and the southeast, or in Kent specifically, over the Christmas New Year period. And then, of course, those spread up the country, which meant that we were a few weeks behind what was happening in London and the southeast. And now, as the case rate has dropped there, you know, it's still higher here. But that's not to say that it's safe, therefore, to sort of relax all national measures. And with the case rate that we've shown you today, still in the hundreds, just below 200 as an average for Greater Manchester, you know, the question would come: could a tier system possibly be strong enough to deal with that? And I'm sure that I speak for all of the leaders in Greater Manchester in saying that we don't believe so. So that's the advice that we've put in to the government. As I say, we're waiting to hear like everywhere else. But at the same time, if I could just add, Jimmy, you know, I am conscious that people are struggling very much with this lockdown. I'm particularly conscious that it's been very, very tough on young people, on school age kids, really struggling over the last couple of weeks. So let's take this carefully. Let's prioritise them coming out of this, is what I would say first and foremost. Let's get a safe reopening of schools underway. But as part of that, I would say that we need to see a return of grassroots junior sport, because I think young people are really suffering for the lack of that activity, as well as not being able to go to school. So my advice to the government will be, let's focus first on children and young people. Let's get them back into school and college safely, and get them back out playing sport, and then let's consider further easing beyond that on a national phased basis.
Thank you, Andy. And I think Bev wanted to come in just off the back of what you just said then. Bev.
Thank you. Really, I was going to say what Andy said. I think that's the right priority. And for once, I do agree with the Prime Minister in what seems to be his approach, which is to take this very, very cautiously and try and make this the last lockdown that we experience, rather than follow some of his MPs and their advice to lift everything very quickly and risk having to do all of this again. I think with the vaccinations and the lockdown, we are making some progress, and I really think it would be disastrous to jeopardise that by coming too quickly out of restrictions, and the focus, as I said, I agree with Andy, should be first and foremost on children and young people. Thanks.
Thank you, Bev. Back to you, Andy, for the next question. This stays on the theme of unlocking, though. This is from Michael Gaffney at Heart and Smooth. Michael asks, given the complexities of factors like deprivation and poor housing, which you've outlined already, plus the different success rates for test and trace in Greater Manchester compared with, say, London, is it fair to simply compare infection rates between different parts of the country to make decisions on unlocking?
Thank you, Michael. No is the answer. And of course, the government itself moved last year to a more kind of balanced approach where it was looking at hospitalisation, looking at trend in cases, the over 60s particularly. I think there's a case now to develop that even further, particularly as the pressure in hospitals, we hope, continues to ease as the vaccination programme takes more effect. So I think we can develop our thinking about the way in which these decisions are made, looking at a broader range of indicators. But obviously the headline case rate will remain kind of a very primary indicator amongst all of that, particularly with the new strains around. And I think that's the issue that we can't get away from, Michael, now, given the situation that we've seen here in the last couple of weeks. The kind of mutations can happen very quickly, the spread can come very quickly, and therefore there does need to be a heightened level of vigilance over those new strains, as they will be revealed in the headline case rate. But I think what I would just emphasise again is keeping a national approach to this. I think will be important as we move through this. The national approach has always been shown to reduce case rates in a way that the regional tier approach never did consistently, and hence let's stick in that kind of approach now and unlock cautiously, but nevertheless as and when the data allows us to do that, and I think that's very much our view here.
Thank you, Andy. So the next question is from Jen Williams at the Manchester Evening News. It still relates to this theme of unlocking or the roadmap. Do you know any more, Andy, about the reasons for the rise in rates in Bury and Tameside, given that we've been in lockdown now for some time? Does it make you nervous at all about the timetable for lockdown easing, especially given that many of the highest rates nationally once again seem to be in the northwest? Do you think the government is paying enough attention to this pattern?
Thank you, Jen. It's a good question, and what we looked at this morning. I mean, the northwest as a whole remains at the higher end of the case rate compared to the rest of the country, and I think the issue, without knowing definitively, obviously parts of Bury border on parts of East Lancashire where there have been higher case rates. We are seeing higher case rates in neighbouring authorities in West Yorkshire, so obviously we are all interlinked. As part of that, we had higher case rates in the Liverpool City region in recent weeks. So the northwest as a whole, it's not just Greater Manchester as it was at times last year. It's very much now the northwest as a whole has got higher case rates than other parts of the country, and we obviously want the government to recognise that if we were to move back to a tier system, the tier system wouldn't be able, in my view, to withstand what might then happen to see with further spread across the region. And there is that ongoing issue of people given an incentive to travel within any tier situation, as we saw in late 2020. So that's where we are at the moment. To pick up what you were saying, yes, we were being advised this morning by our teams that caution was the right way to go. The flickering up of case rates in some of our boroughs, and it happened in Bolton in the last couple of weeks as well, is a cause for concern. We think that is linked to the transmissibility of the new strains and the speed with which they can go through certain areas. So all of this creates a volatile situation that needs to be managed down further before we can see much more substantial unlocking of the economy. So that's the position that we're in at the moment. It's a cautious, national phased approach, and we wouldn't feel comfortable with anything else at the moment.
Thank you, Andy. The next question is from Mairead Smith at the BBC. The first part is on the roadmap out of lockdown, which you've already addressed, really. But the second part is, Andy, what are your fears for the nighttime economy here in Greater Manchester? We're expecting a report from the APPG on this issue, led by Manchester MP Jeff Smith.
Yeah, my fears remain what they were last year, that this situation is really draining the life out of them. And some of the venues, some of the pubs, some of the restaurants won't be able to return. And, that's a terrible shame, because they are the places we love. They are the kind of heartbeat of the city region. And, it's why we've been very grateful to Sacha Lord and all the work he's done throughout the pandemic to raise the position of the nighttime economy. It is critical to the recovery of cities from COVID-19. So we remain extremely concerned, and it's why I'm giving a personal view here, Mairead, but it's why I'm open to the idea of a vaccine passport type idea, to see whether or not we can allow places to open if there is security around people using those venues. Now, it's not something I think it's a complex issue, and I think there's lots of issues to be considered either side, but it's certainly not something to rule out. And in my view, it could allow a safe return of cities and some of the venues that are important to cities more quickly than might otherwise be the case. So it's something that we need to think about as part of a wider support package for the hospitality industry. And if it remains the case that the government believes live events, live theatre, music, hospitality returns in the later part of this year, well, the support has to remain in place through furlough and other forms of support to allow that to happen without losing those businesses. So it's obviously they're looking. There's been lots of leaks in the last few days, not particularly helpful for the industry. The one thing I do pick up very much from them is they don't want the stop-start approach this year. So don't go too fast. If only everybody has to close 2 or 3 weeks later. Let's do this in a careful, planned way. But let's do it recognising that support might be needed until they get a clearer green light to open.
Thank you, Andy. I wondered if Bev wanted to comment there at all on theatre, for example, or other live performance venues, and the way out of lockdown and the impact that has been had on those venues by lockdown.
Yeah, I think Andy's really said it all. To be honest, Jimmy, I don't think there's anything more I can say. I completely agree with his points there. We are concerned about the impact on that sector particularly. It is one of the more fragile in terms of the impact of the pandemic, and they need more support to grow out of this. I've no doubt it will come back, but it possibly won't be many of the same businesses that were there before, and that is the tragedy for so many people.
Thank you, Bev. Andy, back to you with 2 questions now on vaccination. The first is from Stephen Kingston at the Salford Star, and then Joseph Timon at the Manchester Evening News. Stephen asks, Andy, is there any data yet on the effect of vaccination on deaths and cases in Greater Manchester? Joseph asks, sorry, did you want to answer that directly?
It's probably easier doing them one by one, Jim, if that's okay. Not as presented to us, Stephen. There is data, isn't there, emerging nationally. I think it's emerging data, to stress that word, about it potentially having an impact on the overall death rate from COVID, but we've not been presented with any Greater Manchester data. The only data I can point you to today is the easing of pressure on the hospitals, although it's only a slight easing at this point. The other figure I can point you to is which I didn't give earlier, of the top 4 cohorts. The number of people who didn't accept the vaccine in those cohorts was 72,000, which is still a significant number. But having said that, looking then at the other side of things, 90% of people having been vaccinated is a massive achievement. But we are going to work with the people who so far have not taken up the vaccine. So even though it's in theory moving beyond the top 4 cohorts, we are still going to be working to see if we can bring some of those 72,000 people in for a vaccine.
Thank you, Andy. Truthfully, you may have answered the next question, which is from Joseph at the Manchester Evening News, which is about hesitancy and refusal of the vaccine so far. He asked if there was any data available and if there are any areas you're particularly concerned about.
Well, I think just to add then, Joseph, was it? Sorry, Jimmy. Yeah, just to add, Joseph. I mean, the figure we gave before, I don't know whether Kate could go back onto the slide, the vaccination slide. So what we have on that slide is 70 plus cohort, 90% of people having had their first vaccination. So that's obviously people with a care home residents, people with conditions. I mean, that is actually an incredible achievement. I would say 9 out of 10 people who are over 70 in Greater Manchester have been vaccinated. So only 1 in 10 of those over 70s not. That is something to celebrate, no question about it. But the 10% who haven't, as I said, equates to 72,000 people, and we're not giving up on them. So we are going to try and persuade more and more of them to come forward. It might be that some of them are housebound and it's taken longer to get to those people, but I know colleagues in primary care are going to continue to work on that. Just to add, of course, we do need to think about second doses and how we handle the second dose delivery as part of the next phase of the vaccination programme. So it is a complex operation still, but from what I've witnessed in the last week, that it's a highly efficient operation, and I think every resident of Greater Manchester should have cause to be grateful for the people who are out there delivering this successful vaccination programme. And let's be fair, credit to the government too for the way it's been stood up.
Thank you, Andy. Unless we have any more questions from colleagues from the media, we have the final 2 here, and they're both on transport. And the first one, Andy, is from Michael Gaffney at Heart and Smooth. It's been reported that tomorrow's Transport for the North meeting is being gagged by Department of Transport, invoking rules on what can and cannot be discussed in public. Are TfN being gagged by Westminster? And are you concerned Westminster are about to force through Northern Powerhouse Rail on the cheap?
Well, I am concerned about some of the developments with relation to Transport for the North. Certainly the cut in the budget that we kind of were surprised to find out about, and some of the decisions that have been taken around Northern Powerhouse Rail. I think there is a suggestion that the presentation of the business case should be delayed, which is also a concern, given that the government has set up something called the Northern Transport Acceleration Council. That concerns me that we are already going in the opposite direction and starting to delay schemes. I'm not aware actually of why the Department for Transport has asked to take this issue in private rather than in public. I believe, given the focus on levelling up and the promises that have been made around rail investment in the north, there is no real case, to be honest, to consider this in private at the moment. But I will obviously hear the arguments when I attend the board meeting tomorrow. Overall, I am worried that we're seeing Northern Powerhouse Rail being downgraded, being delayed, and that isn't consistent with what has been promised to the north of England. So I will listen carefully to the arguments tomorrow, but I do know there is growing concern amongst some of the members of the Board of Transport for the North about some of the steps that have been taken. It worries me greatly if there's any effort to silence or sideline Transport for the North. Transport for the North is the voice of the North. It's the voice of Northern leaders coming together to say what we think is right for the North, and we're perfectly capable of taking difficult decisions at that board. If we have to, take an overall sum of money and then make the best of it as we can, then we're prepared to do that and trade off amongst ourselves. What we're not prepared to accept is that these critical decisions for the north of England on rail investment that will affect us for the next century are just going to be imposed on us from Whitehall. I think we are all absolutely clear that that is not acceptable, and we are not going to accept second best, and we're not going to accept a situation where all the money is blown on HS2 in the south of the country, leaving us to make the cuts up in the north. None of that will be acceptable to us. I will wait to have the discussion at the board tomorrow before saying any more, but it is fair to say that there are growing concerns around that plans for rail investment in the north are being delayed and downgraded.
Thank you, Andy. And then the final question before you might want to sum up, Andy, is from Alex King at the Meteor. And Alex asks, I understand that you met with Go Northwest management last week to discuss the bus driver industrial dispute, which is due to start on the 28th of February. What came out of your talks with Go Northwest, and what are your views on companies issuing Section 188 notices, so-called fire and rehire notices, as a strategy to renegotiate workers' employment contracts?
So in the first part of your question, yes, it is true that I met Go Northwest last week and had a positive meeting with them. I think there's a recognition on all sides that we need a resolution to this issue, a fair resolution. I encouraged them, together with Unite colleagues, to get back round the table and to come to a negotiated settlement, and suggested that ACAS should be used to secure that. My understanding is that that has been accepted by both sides, and I'm hoping that will be now the next step. So that's the latest situation as I have it. I think there's been a positive development this week. But obviously we will wait and see what transpires. More broadly, I'm very worried about the use of Section 188 because in this situation that we're in now, to effectively unilaterally renegotiate people's contracts is unacceptable. I think this situation with Go is a slightly different situation, given some of the issues that are trying to be resolved. But with the case of British Gas, that I can't see for 1 minute how that can be justified. People who've been out there working through the pandemic, going in and out of other people's homes, all of a sudden find themselves at the end of a year where British Gas and Centrica have done very well indeed with regards to their profits. They then seek to hold a gun to people's head and tell them to accept the new contract or sling their hook. That is industrial blackmail as far as I'm concerned. I don't believe it's appropriate given the situation that we're all in at this time, the whole country's in, with relation to the concerns about the economy going forward. It absolutely falls to the bigger corporate entities to build back better. As we've all heard, but this does not seem like build back better or build back fairer to me. It's the worst kind of tactics coming out of this, further destabilising people at a very difficult time for everybody. So that's where we are. Good progress on the Go Northwest Unite issue. I'd like to thank both sides for being prepared to take this forward to ACAS. We will await further developments, Jimmy. But on the broader issue of Section 188, then I think people can guess they've heard my views there.
Thank you, and that was the last question, Andy, if you want to wrap up.
Okay, I don't need to say a great deal more other than thanking everybody for setting aside a little bit of your half term to come and listen to myself and the Deputy Mayor today. We've made some pretty substantial comments today on workplace safety. and that call on the HSE to reconsider on the need for self-isolation support, but also for building on the success of the vaccination programme to date and the excellent facility that's been stood up at the Etihad. A call on the government to work with us to see if we can boost the utilisation, but also get vaccines made available to that slightly younger working age population, often that has health issues. You know, that seems to me to be a logical next step for Greater Manchester right now. So thank you everybody for your questions and for joining us, and we will see you all again next week.